Well, good afternoon, everybody. This is David Weisberg, the CEO of the Federation for Jewish Philanthropy of Upper Fairfield County. And I'm pleased to welcome you this afternoon to another in a continuing series of webinars that our Federation has been offering the community and beyond during this COVID-19 crisis that we're all living through together and really living through globally, not only here in our Upper Fairfield community, but around the world, which is part of the theme of the discussion that we're going to be having today. So we've done these webinars to bring ourselves together to learn, sometimes to celebrate, and sometimes to focus specifically on the crisis that we're going through. Today we're going to be doing a little bit of learning, and I think a little bit of celebrating and a little bit of learning about the crisis that we're going through together, all at the same time. I'm really pleased to be joined today by representatives of United Hatzalah in Israel, who have really revolutionized medical response time through their Ambucycle program. I first learned of United Hatzalah a couple of years ago, and then shortly thereafter began to learn about some connection between United Hatzalah and supporters in our own Upper Fairfield County Jewish community. Before we get into the discussion, I think it's important to note some very good news that I first learned of this morning, and I think our panelists probably learned of a couple of days ago. That news concerning Eli Beer, who is the president of United Hatzalah, who was himself or is himself suffering from COVID-19 and was, as I understand, in a medically induced coma for several weeks in a hospital in Miami, and was brought out of that coma just a couple of days ago and is breathing on his own. And so this certainly wonderful news. And we wish Eli Beer a refuah shlema. And with that being said, I want to introduce the really wonderful group of panelists that we have for you today representing United Hatzalah. The first of those is Gavi Friedson, Gabrielle Gavi Friedson. Gavi is the Director of International Emergency Management and Global Ambassador for United Hatzalah, and I was sent a bio for Gavi that is so impressive that I think it does bear reading. Gabrielle Friedson has been saving lives since the age of 15. In the course of 13 years on the job, Gavi has distinguished himself through more than 10,000 emergency calls, ranging from acute medical crises to multiple casualty events and international disasters. He has been first medic on the scene at a number of terrorist attacks during his years as a first responder. He spent most of his life volunteering with all of Israel's rescue agencies, and in 2017 returned to the United States to help expand United Rescue's operations. He is responsible for helping and identifying additional United Rescue locations and emergency programs. Gabrielle Friedson, who served in the elite in the Hall Infantry Brigade and served in the spokesperson's unit of the IDF, holds a master's degree in public health, specializing in emergency and disaster management from Tel Aviv University. That is quite an impressive bio. Welcome, Gavi. Thank you for joining us today.
Thank you so much. It's a pleasure to be here and grateful for the opportunity that we live in an era of this kind of technology that lets us do this.
Absolutely. At the end of almost every one of these, I say, let's say a blessing to thank the creator of Zoom and all of these technologies that allow us to come together. Our second panelist is Adi Kanayas, who is an EMT ambulance driver and the head of United Hatzalah in Afula. Very important to this community, with Afula Gilboa being our partnership region. So Adi, welcome. Thank you for being up at night to join us from Israel.
Thank you, guys. Thank you for having me. It's a pleasure. It's a wonderful thing, so we can talk and see each other and ask questions, and I think it's a bless. Thank you.
Right. Thank you. And our third panelist is my friend from Westport, Connecticut, from our Upper Fairfield County Jewish community, Terry Bernard. And Terry always keeps United Hatzalah on our radar and has helped to build a special connection between our community and this important organization in Israel, which I'm going to have her speak a little bit more about later in the webinar. But Terry, thanks so much for joining us and for encouraging me to put this together today.
Thank you, David, for all your help.
So let's just get some basic background on United Hatzalah, what it is, how long it's been in existence, the scope of the work that you do, the Ambucycle program and beyond. So Gavi, give us some background on United Hatzalah.
Absolutely. So United Hatzalah was actually founded in 2006 when we merged with several other small local Hatzalah organizations during the Second Lebanon War. We realized, actually some of the reasons we actually were able to, lessons learned after 9/11, where we had a problem with the lack of communication and coordination with the rescue services, where in the sense the fire department was on one channel and the EMS was on a different channel and the police went on another. And we had that in 2006 in Israel during the Second Lebanon War, when there was a big problem with the communication and coordination of different Hatzalah groups. And we realized that we all need to be under one umbrella. And Ellie Beard, you were talking about before, who miraculously, a real Passover miracle, and we're so grateful and thankful that a few nights ago, he came off of the ventilator and is expected to make a full recovery. He founded this organization, understanding that there was a problem within the medical system in emergency first response, that ambulances are a great tool of transportation, but they don't save lives. They're a great method to get a person from the home or hospital or old age home to evacuate them, but it's not a fast way of getting to a person in crisis and in need in those first 3 critical moments. And he realized if you can have a delivery system on the back of a motorcycle for pizza with that arrives so fast, why can't we deliver life even faster? And in 2006, we merged with all the small local Hatzalahs and we created the second largest actually emergency national response organization right now in Israel, and the fastest response time in the world, where our medics are, it's a free volunteer-based emergency medical service where our headquarters is based in Jerusalem, and we provide immediate medical intervention during the critical window between until the ambulance arrives and before the most critical needs. So we're able to fill that gap until the ambulance arrives. And we arrive within 3 minutes or less, in some cases 90 seconds. Now, as a volunteer medic who has gone to over, as you said before, as you read my bio, over 10,000 emergencies, I can't tell you how important it is to get there within 90 seconds. It really is the fastest time in the world. I'm sure Adi, who is one of an ambulance driver as well, and on the call live from Afula, he's in charge of the Afula region, is going to share with us later how important that time is, how unique it is. I spend my time here now working with other medical organizations and people, just trying to understand and influence and share our knowledge and our capabilities of the amount of lives United Hatzalah is able to save every single day. We treat over 2,000 emergency calls a day. In a moment, we'll obviously get into everything that's happening with this corona global pandemic and how our medics had to adjust to this new kind of life in responding not only to the every single day kind of stroke or heart attack, but also being prepared to respond to people's homes who could technically have the virus. Our responders are all volunteer. They're mixed of Christians, Jewish, Muslim, 6,000 volunteers who work every single day in any other job whatsoever, but then find the time to volunteer with our organization, United Hatzalah. And Hatzalah is the Hebrew word for rescue. So working united together, all walks of life, to respond to every emergency in Israel within 3 minutes or less. So again, it's the fastest response time in the world. We are working every single day within communities all the way from north in Metula, all the way down south to Eilat, with first responders who stop whatever they're doing and go off and respond to emergencies to help their fellow strangers, neighbors, family. And we are integrated in the emergency 911 system. And people can call us. Again, our headquarters in the last couple of weeks has been flooded with emergency calls. We also partnered with an organization that we now have 30,000 volunteers just working on humanitarian calls. So just in the last 24 hours, we've responded to over 2,000 incidents of just humanitarian cases where people needed help with anywhere from a plumbing issue or elderly people at home that aren't able to get medications to people who need food. So on top of just the medical emergencies, our organization is doing everything it can on a humanitarian basis to get out there and respond and be involved in the community. And Adi, who is so generous, who's an ambulance driver, actually taking a few minutes off of his ambulance shift at the moment to join us live from Afula, will be able to share with us as well the situation on the ground there and the impact that we have and our medics are doing. And again, this is something that the entire world is feeling. And it's amazing that we're able to all help each other and support each other and be able to really get live feedback of what's happening on the ground in Israel at the moment. But this organization is really just, it's incredible, and it's vital to the public health and the front lines of what's happening now in Israel. And I can't thank enough all the doctors and all the nurses and all the paramedics all over the world who really are on the front lines when it comes to this specific pandemic. But just every single day, just being able to stop what it is that we're doing to respond to an emergency in 90 seconds, get there, stop the bleeding, apply oxygen, do whatever we can until the ambulance arrives to transport the patient. So it really is just an amazing organization built on volunteering. And I always say it is the ultimate tikkun olam, to really get out there and shed that light to the world of how innovative Israel can be and how our volunteers work together like a family to save other people's lives. So
I mean, that's great. I'm going to share on the screen a picture of an Ambucycle, or at least I'm going to try and see. We should have it now. And I just thought it would be helpful if you could explain how it's equipped, what are the capabilities, what can you and can't you do with the Ambucycle, and how it's revolutionized the work that you do.
So excellent point. The Ambucycle is a method that we use that we're able to get through traffic without having to worry. Like if you look at all the ambulances on the road, you're always seeing them stuck in traffic. They're just too big. Last time I was in New York, obviously before this pandemic, I would see ambulances just stuck in traffic for maybe 10 minutes before they can even get through the intersection. Eli Beer had an amazing idea, and he realized that an Ambucycle is a great way to have two medics on it, and everything that's in the ambulance is in this motorcycle, which we call an Ambucycle. From the oxygen tank, which we took an oxygen tank and we cut it in half and made it a mini oxygen. And we basically modified everything that's in the ambulance except the stretcher and put it in the back of the Ambucycle. So if a defibrillator, EpiPens, blood pressure kits, everything from BLS, basic life support, to advanced life support is in this Ambucycle. And our medics are able to take it with them everywhere they go, from the supermarket to their jobs. And the second there's a crisis, they get alerted with our technology on our Bluebird system, which is our sort of walkie-talkie communicative device. And we stop what we're doing, hop on the back of the motorcycle, Ambucycle, and we respond to lights, sirens, and we were able to get to every emergency. This is one of the fastest tools for us to get to somewhere in 3 minutes or less. Now, not every medic has an Ambucycle, of course. Other medics have cars, and we have lots of other tools that we could talk about in order to make sure that we're able to have our first responders get to the scene in 3 minutes or less, because that is one of the most important things for us, is to get there fast and safely and efficiently so that we're able to provide those first levels of first response, those first life-saving measures before an ambulance arrives.
Right, and it's a good point that I was hoping you would make. Obviously, you can't do patient transport on an Ambucycle, but you're getting there quickly.
I haven't tied anybody on the back of my Ambucycle yet. Maybe
right.
I've done that. We try not to, though. The whole point is to get them to the hospital safely. But,
Great, Gabi.
Can I just mention that was Eli Beer in the picture also?
Yes, that was Eli
Beer. Prior to Corona. Yeah.
Right. Thank you. Thank you. So Adi, thank you for joining us today. Thank you for
Absolutely.
taking time out. And obviously, if you get a call, that call takes precedent over us.
Yeah,
So
absolutely.
we're
Well,
happy
the
for
call
all,
will hang up the phone anyway, so
we're
I'll
happy
be
for
out.
all kinds of reasons that you don't have a call right now. Adi, tell us about the program in the United Hatzalah program in Afula and how things are going right now with the COVID-19 crisis.
Well, first of all, I would like to say good evening and thank you for having me. It's wonderful to see you guys and be able to talk. Well, right now, as you can see, it's dark outside. It's a little bit chilly. Uh, I believe there is a lot of people staying at home right now. The streets are empty like everywhere else. Thank God for that. So people not going outside and getting hurt. But during the daytime, people still going shopping and going around, and there is the usual calls like accidents and stuff like that. And we have in Afula about 60 volunteers that work in the area, live in the area, and they are getting the calls during their work time, home times, whatever it is. They drop everything and they run to give help. But today it's a little bit harder and difficult because you have to be prepared. You have to be covered. You have to have a mask and a glove and the suit. Sometimes you cannot just jump into an apartment or whatever and help people if you're not sure they don't have the COVID-19. So you have to be very, very careful, and you have to carry a little bit more of equipment than usual. And sometimes we're a little bit short with this equipment, and our volunteers really would like to go up and help somebody, but they cannot do it because I told them, don't risk yourselves. You want to help people, that's wonderful, but don't risk yourself. So we do need some more of this equipment today, so our guys can help people, and people are staying at home for like 2 or 3 weeks at a time straight, and they need not just medical help, they need some medicines and groceries and whatnot. And the older is they cannot go outside at all, they have to stay home. So by the time we don't have emergency calls or we don't work, we spend a lot of time just going around buying medicines for the elderlies, getting the medications, getting the recipes, go and do some shoppings for them in the supermarkets, stuff that they cannot do. Delivering hot food from, sometimes the city over here in Fula, they give away hot meals. So they do need the volunteers to transport all those meals to the people. So we do that as well. Our guys just running around. Well, today, it was the most wonderful morning I had for a while. Some of the volunteers in Afula, which by the way, had Muslims, Hebrew, Christians, Arabs, it's a mix. And a few girls today gathered together, bought some roses, and drove around all the volunteers, woke them up, knock on the door, and give them roses and said, thanks for what you guys doing. To wake up today with the roses like that, I'm telling you, it's the most beautiful morning I had for a while, and it put a smile on my face. So I feel good about what we're doing over here. It's a great job. It hurts sometimes that you cannot do what you really want to do and trained because you don't have enough equipment or whatnot. But hopefully we'll get over that, and we can keep going with the beautiful job that we're doing over here. And our volunteers are, I'm telling you, they're all angels. They run around, they do whatever they can, so nobody will stay with no food, no medicines, or whatever. So it's a blessing to work with people like that, I'm telling you.
Right, Eddie, I'm going to share a picture on the screen. I think it might be you.
Yeah, that's me. About a month ago.
That's what you look like in quarantine.
Yep. That's before and after picture. That's me with the beard over there. That's how I looked like a month ago. Well, I had to take it off. As you can tell, it's a big thing to cover with a mask. So I took it off. It will grow back again, I believe. That's okay.
And I'm interested in just what extra level of training do you have to provide your crew when this crisis happens, and how does that happen? Do you pull everybody together? Do you just disseminate information? How do you manage it?
Well, God forbid, put everybody together, it's a crime.
Right.
So we didn't do that. But well, when it begins, just in the beginning, we make sure we had the equipment that that we need, masks, gloves, the suits and whatnot. And we decided to tell the people, you know, there is calls that you cannot go if it's a fever and stuff like that. Just don't go. Wait until the ambulance will go and do the job there. But if it's something, you know, really dangerous and people are lives at risk, so we have to go, and we give them the equipment. The people over here, they're so great. People just work day and night to get us the equipment that we need. So it won't be even one person that we cannot go and help. And drivers are going from Jerusalem to Afula almost on a daily basis, not just to Afula, everywhere, and deliver, you know, equipment that we do need every year. And I told them, just be careful and keep going, keep doing the job. So a lot of people not working right now because the jobs are, you know, off and everything is closed. So they do have time, and they're spending this time, you know, just delivering, as I said before, medicines and food and whatnot. And I told them, just be careful. Whatever you do, if you need to give an order of food, just knock on the door, leave it on the carpet, and go. Don't wait for a thanks or a hug. You know, just leave it there and go. So that's basically the daily you know, routine that we have in here for the last couple of weeks. It's just getting harder and harder with the holidays right now, and you know, everything closed anyway, and they put everything shut down, so complete shutdown. I mean, you cannot go outside on the holidays. So people do need to be prepared. They need the food, they need whatnot. So we're running around like crazies, and we're using, you know, every tools we have. I'm using my own personal car, even though I do have a motorcycle. I use that to you know, for the emergency calls. But I do use my own personal car, and I do deliver food. And I don't know if I can show you that, but it's behind me. On my car, there is stickers of United Hatzalah all over. So I can use that as a carbulance or whatever you want to call it as well. I do have equipment there. And when I do my deliveries and I get a call, I go with my own personal car, and so the police won't stop me, and I can get there on time. We still, you know, we have to be very, very fast to get to these people. Otherwise, you know, we're missing our point. So we do get there 90 seconds or less in Afula only. Other than Afula, I don't know if you know the area, there is a lot of small villages and kibbutzes and whatnot around here. So there is a lot of communities living around Afula, not just in Afula, that we do need to get there. And thank God we have people or volunteers that live in these areas, you know, so they give first response there, because by the time ambulance will get there, it'll be forever. Sometimes it takes even 45 minutes, half an hour for ambulance to get from Afula to these areas. But thank God, you know, our people doing their job, and they're doing it great. Right. We have doctors, we have nurses, we have paramedics, we have medics, we have, you know, everybody that can do any help. We're using those people. It's
and Adi, just quickly, what's your sense of the COVID-19 situation in Afula? Is it overwhelming for those of us who are familiar with places like Emek Medical Center? Is it a situation that's manageable right now, or are the numbers significant?
Well, the numbers are still going up, but not as fast as they went on the beginning, thank God. But it is scary. It is scary. There is a police on the streets. They close down the cities at night. The city of Afula is closed. During the daytimes, they do have police will stop and ask you where you're going. If you're not, have to go, just go back home, because the numbers over there are really high. And there is a hospital over there, so you need to understand that sick people from all around getting into Afula to get medical care. So there is a lot of people in hospital. You don't want to go there if you don't have to. And that's why most of the time right now, when we do go and give some medical help to people, we don't recognize always go to the hospital. If it's something is okay, it's a small cut, we'll take care of it at home, and we'll keep you home. If you don't have to go to the hospital, just don't go, because it's crazy what's going on over there. It's packed.
Right. So Adi, I know we're all so grateful for the role that you play there in our partnership community in Israel. Thank you for your leadership.
Absolutely, my pleasure. Thanks.
Terry, I wanted to be able to share with everyone the special relationship that's developed between folks here in Upper Fairfield County and United Hatzalah that you've helped to grow. So can you talk a little bit about that partnership and how you got involved?
Sure. So in 2017, I learned about a distant cousin in Israel who had started the psychotrauma unit of United Hatzalah in 2016. I didn't know much about the organization at that time, but I was quickly impressed by the fast response times achieved by using the technology, the volunteers, and the ambucycles. And as you heard, the 3 minutes or less is incredible. Miriam Ballin, my cousin, was training mental health professionals at the time to go on calls to help with the emotional impact of traumatic events on victims, family members, and bystanders. So I guess that program is up and running, and I think they have over 500 volunteers now. And so at the time, I organized an information session when Miriam was in the United States for family and friends, and we were able to raise enough money to sponsor an ambucycle for one of the volunteers. And now we get updates on a somewhat regular basis, so we can see the incredible life-saving work that is being done in the community. So, thanks to some of these people here in Fairfield County, life-saving work is going on in Israel. So thank you to Gavi and Adi. I mean, it's just incredible what you do. And thank you, David, for putting this together. And also Miriam Tenenbaum, who's in New Jersey now, working also with United Hatzalah. So I'm really excited about this.
And Terry, thank you. I think it's a great pride to our community to know that there's an Ambucycle that now exists for United Hatzalah in Israel because of the generosity and leadership of members of our community. So thank you. So Terry, you had shared with me a video that was shared with you of the volunteer and Ambucycle that you helped sponsor, that I think I'm going to try to share that with everybody. That's a couple minutes long. And so before I start that, I wanted to let everyone know who is in the audience that when we come back from that video, we're also going to give the opportunity for you to ask questions. If you want to ask a question, you can do that in one of two ways. One is that you can just type your question into the chat feature in Zoom and I can read it there. But also if you use the virtual raise your hand function, I can call on you and I can move you into being a panelist so you can ask your question in real time. I'm letting you know that among other things because if when I move you over to being a panelist, you have your video turned on, it means you'll be on the video that everyone who is watching this is watching. So if you're like some of us who on some of these days that we're working from home are still in your pajamas, I want to let you know before you may have your video on for everyone who is watching. So we'll look forward to your questions, but I am going to try to share this wonderful video right now.
שמי ישראל כהן, אני גר בירושלים, אב לשלושה. אני חובש באיחוד הצלה, גם מתנדב ביחידת חוסן, וגם נמצא בפרויקט של תן כבוד. עקב זה שהיום זה יום השואה, אז אני אסביר על פרויקט תן כבוד, שאני משתתף בו. תן כבוד זה פרויקט שאנחנו מבקרים אנשים מבוגרים, קשישים, שלא כל כך אנשים מבקרים אותם, או שהמצב הבריאותי שלהם מדי פעם צריך בדיקה, ולכן אנחנו מגיעים ובודקים להם כל מיני מדדים מסוימים כדי לראות מה המצב. לחץ דם, דופק, סוכר, מדברים איתם, הם מספרים לנו כל מיני סיפורים. תוך כדי הפרויקט אנחנו נפגשים עם הרבה אנשים שהם ניצולי שואה, שבדרך כלל הם מרגישים לבד ואין מי שיבקר אותם. בפורים לדוגמה לא היה מי שיקרא למגילה, הלכתי וקראתי למגילה וגם הבאתי לה משלוח מנות על הדרך, וגם עשיתי את הביקור השבועי. הסיבה שאני משתתף בפרויקט תן כבוד זה בגלל שהם מרגישים שהם לא לבד, וברגע שאני מבקר אותם זה עוזר להם. אני רואה שאני מבקר אצל הקשישה שלי, שזה עושה לה טוב, היא מרגישה שהיא לא לבד, זה נותן לה ביטחון, אני בודק לה את המדדים שלה, לראות שהיא בריאה, והיא מרגישה בטוחה מזה, וזה עושה לה רק טוב. אלו היו 90 שניות על הצלת חיים, שימו לב!
Terry, thank you for sharing that video with us. And I thought it was particularly timely with Yom HaShoah coming up just next week to see that the role that United Hatzalah is playing not only in emergency response, but in support of vulnerable populations in Israel. So thank you so much for sharing that.
Thank you. I think if it were a very current video, he would be wearing a mask and other people would be wearing masks as well, but it's still relevant.
Absolutely. So we do want to welcome questions. If there's any questions, as I said, please either type them in the chat feature or virtually raise your hand. But while we're waiting for a first question, I'll ask a pretty obvious one to Gavi, which is if folks in our community or elsewhere are watching this and saying, I want to be supportive, I want to be part of helping this program grow, what do they need to know? How can people help make a difference?
Absolutely. Well, first of all, again, thank you both to you, David and Terry, for putting this on, and for your partnership means so much. And as you can see, as we're talking to Adi in Israel, the effect that it's having on people's lives, and literally responding every single day. Before I got on this call, I spoke to one of my friends who just was called to deliver a baby. And even in these times of the corona, it's amazing that we're still able to get there within, in the first 3 minutes. And deliver life under such crazy circumstances that the whole entire world is in. And it's really unique. And our medics, like you said, in the Ten Kavod program, which I used to volunteer with as well. And I used to go and once a week make sure that they had food and water and medicines. And it's something that will forever be in my heart and my memory of those days that I would go once a week to visit those elderly. And it's something that you can't learn in a textbook, and you can't even describe it, the feeling of, and it's not even part of being a medic, it's just being a human. And the humanitarian aspect that our organization provides to the community is just so vital. But again, it's the partnership that we have with your community that keeps us doing what we're doing. And so I would tell anyone that's in your community that wants to help. So first of all, please go to our website, israelrescue.org. See what you can do to help us, especially in this moment with this pandemic. The PPE, which is that personal protective equipment, the gloves, the masks, the oxygen tanks are so important to our medics to be able to respond. We need more equipment. And, you know, that money goes directly towards that. And something that Terry pointed out are these updates. And that's what's so amazing about our organization is the fact that if someone donates, let's say an Ambucycle, you're getting up-to-date updates on who that medic is, where that medic is going. If, let's say, Terry, you help support or adopted a D, you'd be getting medics from a D, you'd be getting email updates on what a D is doing in Afula. So it's not like you're just making a donation and never hearing from it ever again, but you're actually getting to stay connected with your volunteer on the ground in Israel and getting live updates of what exactly he's doing and how impactful your dollars are, which is really just something that is so unique. But I would really, really encourage anyone to, after this call or even during, to go to israelrescue.org and see whatever it is that you can do. Anything big, anything small, anything matters. Every dollar helps our volunteers right now. And I'm sure Adi can add to that these masks and the equipment, we're ready to go. We're on the front lines. We just need to make sure the number one thing they teach us in our medical course is safety. And we can't risk our own lives, which we do every single day, just being on a motorcycle and going through red lights. We're willing to do that, but we just need to make sure that we have the right equipment. And
Gavi, this actually, it feeds into the first question that I had sent in to us, which is, in the United States, many hospitals are running out of personal protective equipment. Is there the same kind of shortage in Israel? Is it a question of access or just a question of having the money to purchase these items?
I would say both. I mean, first of all, you know, this equipment is not cheap. It's expensive equipment, and we don't want to get to the case where we have to keep reusing the same masks for weeks. Then it's just not effective. There are shortages in supplies, but we are able to get some. 2 weeks ago, we made a $400,000 purchase of oxygen tanks and masks and protective gears and eye shields, and we're going through it. I mean, we have 6,000 medics, but don't forget, we also have 30,000 volunteers that are on the humanitarian side, helping with people that just can't leave their house, can't get the medications, have issues for just basic humanitarian needs that our volunteers are able to go to. But every home we enter, we have to treat it as if it's somebody that could possibly have the virus. Adi, you could tell me as well, or add any information that I missed.
Well, there is one thing I really want to point out here. Those volunteers are, you know, putting their lives and their family lives at risk when they go out and getting into other people's apartment. Well, you all know this is not something that you want to do today, but people do need this help, and we do need to do the job. And the hardest thing for me as a head of that group over here, it's to tell somebody, nah, I'm sorry, you cannot help him right now, stay outside because you're missing a mask, or, you know, something like that. So for us, the pain that we cannot do our job, that we already, you know, live day and night and doing it, you know, all the time, but sometimes we have to do it. We have to stop people from getting in and helping somebody because they don't have enough protected gear that right now we do need over here. And thank you guys for, you know, for helping us with that. So we can just keep on going and volunteers and do our thing, and you know what we do need to help people, and that's all we really want to do right now. It's, you know, give hands to those people, because to see people that hungry for food, and you know, people sick that don't have a medicine for a couple of days, it's terrible, and they cannot go to the hospital, you know, because they cannot help them there. They just need somebody to go and get the meds, and so they can feel better. That's all they need. And they cannot go outside. But if we don't have enough gear to protect ourselves, we cannot even do that. So it's a great feeling, you know, to help these people, and to see grandpa really want to give you a hug, and the grandma is crying because you just give them the medicines, and, you know, they're okay now, and they feel safe. They talk to you outside the door. You know, we're standing sometimes still in the elevator and knocking on the door, just living there and the stuff, but they know that we are coming, so they're waiting for us, sometime with a song, sometime with a flower, you know, a balloon. It's a great feeling. It's a great feeling to see those grandpa and grandma, you know, happy because they do have the medicines right now. And we do, you know, go and buy some groceries for them if they need sometimes and all that. It's a great feeling to help these people. We just need the, you know, to be safe and have the equipment that we do need to keep on doing that job.
Right. And Adi, is this part of the 10 Kavod program in Afula, or is this beyond that?
No, the 10 Kavod, it's, well, the base of this entire thing over here, because 10 Kavod, it's been around for a while now, more than 2 years. We do go and help, you know, oldies that they don't have anybody to help them on a daily basis. So we do go there once a week, and we have volunteers that just have you know, a person. They call them, they go there once or twice a week, check up their blood pressure and sugar height and whatnot, sit down, talk to them, see if they need anything. We're doing that for a while now. Our volunteers are, you know, trained for that. But these days it's a little bit different because we're not just having one elderly guy that we do go. It's like hundreds, you know. We go for every volunteer here goes to at least 10-15 homes on a daily basis, you know. So we can cover as much area that we can because it's everybody, all the older and everybody close at home. They cannot go outside, you know. So we do have a lot of work. We do have a lot of work.
Right. So Gabi, here's I think a really interesting question. So can you discuss more details about the humanitarian hotline? Why is there a need for it? Aren't there other organizations in Israel who manage social issues? Why was there a need for United Hatzalah to have to step into that role?
So it's an excellent question. And actually, several of those other organizations that are humanitarian organizations that deal with this every single day approached us, United Hatzalah, because of our amazing network of volunteers and how fast and efficient we are. I mean, to have 6,000 volunteers being able to respond to emergencies or just a response time of 3 minutes or less, it was basically a natural fit for them to want to approach us and help use our communication devices and our technology. And we are now trying to work with other volunteers and getting the walkie-talkies and our equipment and taking people like Adi, who's ahead of a certain region like Afula, and then putting him together with a person from that organization. And that's how our network has expanded. And there are so many basic needs. Basically, this 10 Kavod program has turned the entire network of not only all these humanitarian organizations, but our organization as well, because everybody is locked inside their homes and needs these basic needs, and especially the elderly who are so vulnerable, who are not able to get out and get the medications that they need. And I think it was a natural fit to use United Hatzalah. And again, all of our volunteers, everyone that I'm speaking to in Israel, they're doing so many of these humanitarian calls, which are life-saving calls as well. I mean, people without their medications and without their refill on their meds, I mean, it's very dangerous. So the positive side, I'd say, in Israel right now is there aren't as many traffic accidents. So yes, for a country that has a lot of traffic accidents, I think it's an amazing thing to see that there's a reduction, but it doesn't mean that there's a lot of people that have other health issues that are not able to get to the doctors that might need to get to the doctors. There's a pro and con on everything. So yes, there's a reduction in traffic accidents, but yeah, there's people who could be having heart issues that are not able to get to their hospital or to the doctor that they need because everything got put off because of the ventilators, and there's just, it's like a whole cycle of issues. To be able to be on the front line and get to these folks and get them what they need is really, really, really crucial. And that's what we're doing. I mean, we also formed a task force just to work with an old age home last week, because we saw in Israel, one of the biggest problems right now are the old age homes. And a lot of the employees and staff and the nurses at these old age homes are just not showing up to work. They don't want to get the virus themselves. They're just calling in sick, or they have to be in isolation. And we have an emergency task force with a number of paramedics and doctors that are filling in for other nurses at old age homes to provide that medical care. We also have a bunch of paramedics that are on call now to help with the ventilators in hospitals in case any of the paramedics that are on staff at the hospitals get sick or are exposed to the virus. So we have a whole chain of volunteers that are available to help not only our organization, but that are also on a list to help the hospitals and old age homes that are all part of the humanitarian organization that we're dealing with.
I mean, I appreciate you bringing that up about the senior care facilities. We're having the same kind of challenges, of course, in our Jewish Senior Services campus here in the community, where more staff are getting sick and there's a need for additional support and just things to build morale. And we had sent a message to our community yesterday about the heroes that work at our own Jewish Senior Services facility, and want to encourage the community to be supportive in whatever ways they can. So a question, Adi, are you seeing any positive signs that the spread of the virus is getting under control in your area?
Well, today I did saw the first sign that, you know, I thought that that's a point. Our volunteers doing their daily routines, not just today, but before. Well, today they not. We are going to the emergency care in the hospital over here in Afula, the AMEC, and we do volunteer in the emergency area, in the emergency room, on a daily basis. People are just going there for 3 or 4 hours at a time, and volunteers, and helping the staff with the work in the hospital, in the emergency care. And that's what we do on a daily basis during the year. We just go and do shifts over there and helping the people. When the entire thing started with the COVID-19, they told us, guys, we do appreciate your work. We do need the help right now, but the hospital is shut down, so you cannot go and volunteer. Only people that actually work there are allowed to be in there. So they told us, stop coming. Don't volunteer right now. We don't want you here. We don't want you to be in risk. And today, in the morning, I got a call from the hospital, and she told me, listen, you guys keep sending me messages that they want to come and help. But today she got an okay from the managers, so we can come again and volunteer there too and help these people. I'm talking about the staff. I'm talking about the staff over there. They are exhausted. They're working day and nights, you know, like crazy. And our guys really want to go and help them too. So today we got an okay to go ahead and do that. So I believe that's you know, that's a good sign. That's a good sign for us. So you know, if the people in the hospital believe it's okay for us to come and be there, maybe things are in control right now, so they're not going to put us at risk, you know. So I believe it's a good sign. I believe it's a good sign. Hopefully we'll get the end of it soon.
It's a very positive news, I hope.
Yeah, absolutely.
Gabi, I want to get a sense of what the additional kind of financial burden on the organization is during this crisis.
We're looking at anywhere close to about $2 million. So, I mean, we're really working hard on trying to fundraise and you know, get support from wherever we can. But again, it's not only that we have to make sure that our 6,000 plus medics, plus the 30,000 volunteers and organizations for humanitarian causes are well equipped with all this PPE. It's also our ongoing emergencies that we respond to, where we respond anywhere between about 2,000 to 2,500 calls a day. Right now it's a little less, again, because there's not as many traffic accidents and people are staying at home. But my friend, the paramedic, as I told you right before, delivered a baby. So we're still responding to emergencies that are happening. And these medics, I'm sure, are just as busy. And if anything, we're even busier because we're responding to the humanitarian cases of 14 to 15 calls a day of just stopping and supplying medicine and food to people in our neighborhood. So the cost, we did a breakdown cost on the PPE and the oxygen tanks, and it's coming close to about $2 million.
Wow. And
so
is the government, either nationally or municipalities, funding partners?
Great question. So right now, no, we're not getting any money from the governments, but we work with the Home Front Command, with the Ministry of Defense. We're working with all the ministries and in compliance with them, and they're coming to us to help us, with our the partnership's incredible. But funding wise, it's a big issue. Obviously, as you know, in Israel, there's a lot of bureaucracy at the moment. There's not a functioning government, which they're still trying to figure out. So there's just a lot of issues when it comes to the finances between the government. And at the end of the day, we are a nonprofit. We're a nonprofit, but we are one of the largest medical organizations. So we are on the front lines, and we're integrated in the system that helps all these ministries every single day. So we're working with everyone from welfare to social workers to the defense ministry, the home front command, to even the Navy SEALs, the Shayet Shlosha says, what they call in Israel. We're working with us not only on our technology, but also they took our empty oxygen tanks and re-collaborated them and brought us new ones. So it's an effort, but especially in Israel, it's everyone working together, hands-on, grassroots. And I think our organization, what's so unique about it is our sense of community and how we work together, and we're so vital to everyone's community. So it's really just an incredible organization.
Great. So a little bird just whispered in my ear a very intriguing question, which is, can you tell us about the coronavirus tracking app that United Hatzalah has created?
Adi, are you using that app in Afula?
Absolutely, everywhere, not just in Afula, everywhere I go.
So tell us a little bit about it. It's amazing.
Well, it's a great thing. I mean, it's getting updated all the time, and sometimes you do need to take the ambulance and drive from Afula somewhere else and get a patient, and you need to go home or whatever. When you get to the building, you just go into the app. You just open it. It shows you exactly how many sick people are around you. So you need to be careful or not. It's a good area, not good area. Get covered, put a suit on and whatnot before you're getting outside. It's a great thing. It helps us a lot. We do appreciate it.
I think many of us here would like to have access to an app just like that as we try to figure out where we can and can't go.
It's a great thing. It's a great thing. I tell you, if you need to go to if you need to go to a supermarket, for example, it's a great thing because it shows you if there is a sick people in there or not, if it's safe or not to go in. It's great.
That's.
Since you don't have the app yet in the United States, I highly encourage, especially when you go into the supermarkets, is just to continue the physical and social distancing, the washing the hands, and treat as if everywhere you're going could be potentially contaminated. So especially in the supermarkets, just make sure you have a mask and gloves if you have.
Absolutely. Terry, I want to come back to you and hear if you have any hopes and dreams for growing this partnership between our community and this amazing organization. And we're not hearing. We got to get you off of mute.
Sorry, there we go.
There we go.
Okay. I mean, anything we can do to help, but it would be amazing if we could raise more money for an Ambucycle in Afula, or just generate some additional help for PPE and things that are needed right now, in particular during this crisis. So that would be amazing.
Great. So Gavi and Adi and Terry, I want to thank you all both for your time today or this evening in Adi's case, but more importantly for the work that each of you has done and the leadership that each of you have demonstrated to help to build this organization, which is, of all of the more importance to all of us in situations like we're all living in together right now. So thank you very much for the work that you do on a daily basis, Adi, particularly for the work that you're doing on the ground in our partnership community. It's so much appreciated, and I'm so grateful for the opportunity to learn, because learning gives us all the opportunity to make additional impact, to understand that the ways that we can help make a meaningful difference. And it's also a sense of pride always to see Israel leading the way when it comes to innovation in medical response time, in tracking apps, and all of these things that make such a difference. And I think it's most fitting to end this webinar by once again wishing a refuah shalema to Eli Beer, and to send our best to him and his family. And we're so grateful to know the positive steps that he's been taking forward. So we wish him a full recovery. I wish all of you a continued Chag Sameach and good health and tremendous gratitude for the work that you're all doing. Thank you so much.
Thank you.
Thank you, guys. Thank you very much. And if Eli hear that, we're waiting for you here at home. Hopefully we'll see you soon. We're not going to hug you, but we just want to see you home.
One of the last things Eli said before getting intubated and going on the ventilator was asking for the world and for everyone just to continue to do mitzvot and to do, to pray, and it really, really works. And as we can see, he just had 3 weeks fighting for his life on that ventilator. And it was a real Passover miracle where he is off of it, and we can't wait to see him thriving again, just like he's done, because he's really saving so many lives. And no doubt in my mind that the amount of lives that have been saved because of him, God knows it, and it's, there's a lot more work to be done on earth here. So
Eli, thank you, and good health, and stay safe and good health to all of us. And Chag Sameach.
Chag Sameach.
Thank you.
Bye-bye.